I'm Dr. Satish Rudrappa, Group Director, Astor Whitefield, Bangalore. Today I'll be talking on the surgeries for epilepsy. I have few videos. If you've had a chance to visit that, I would have explained about what is epilepsy, when to give the medical treatment, and how it can be treated with a medical treatment. And please visit Astor Whitefield website and you can go through those videos before coming to this part of my video. As I mentioned in my previous videos, 95% of the patients can be cured or controlled with medication. Surgery is rarely required for 5 to 10% of the patients. And when do we advise surgery? So we call it as rule of 2. If anybody is having epilepsy for more than 2 years, if any patient is taking medication for 2 years with more than 2 anti-epileptic drugs, and if he's getting epilepsy of more than 2 episodes per week, we call them an intractable seizure. So what we call intractable seizure. These kind of patients, who are either neglected their medication or, taking a medical treatment before, or in spite of that, there might be an inappropriate medication can be given, or there must be a structural abnormality within the brain which is creating this intractable seizure. How do we diagnose this? The diagnosis requires a different methodology in this. As I mentioned earlier in my videos, epilepsy is not a disease. It is nothing but an electrical current arising from one part of the brain, spreading like a lightning to the rest of the brain. So what we do in investigation is, where is this spark of the lightning coming? So if we identify that part, and if I treat it with removing that or burning that area, most of the intractable seizures can be cured. So how do we diagnose that? The most important thing we do is EEG, electroencephalography, where we put the electrical leads to your head and we monitor it for about a day or sometime when it is not easily pickable, or sometimes we do it for 4 days. We call video EEG, where we connect you with a video, whether you go to the bathroom, where you are eating, where you are sleeping, talking. We continuously monitor your electrical activity. We call it video EEG, where the video will show where exactly in the body your fits is originating, which correlating with the electrical lead which we kept on the brain. So it matches. Then we get to know, yes, it is arising from the frontal lobe, it is arising from the temporal lobe, it is arising from somewhere else or from both the brains. So once we get this idea, next step we do what is called an MRI with a 3 Tesla machine, where it will show if the EEG picks up one particular part of the area of the brain, same area in the MRI it picks up the low signal. I know that it is matching. And even these two matches, we do the third test by giving the nuclear medicine, which will be called as PET scan, positron emission tomography, where we give small amount of the dye, which will go to the area of the epilepsy, which will take lesser, this medicine which we give, rest of the brain looks all right. We call hypometabolism. And when this EEG, MRI and PET scan, all three show from one area, you are the best candidate for surgical excision. And if it is in the area which is non-eloquent, that means it's away from the speech area, hand area, eye area, if you remove that part, believe it or not, 90 to 98% of the patient can be cured. One of the commonest problem is we call epilepsy is medial temporal sclerosis, which usually happens from childhood febrile seizure converting into complex partial seizure, where the medial part, that's the innermost part of the brain, becomes a scar, which can be easily picked up with these 3 tests which I told you, EEG, MRI and PET. And in such patients, when we do surgery, we are nowadays finding 90 to 100% of relief to these patients. And those patients where we do not pick up one area but spreading to multiple area, don't get scared. There is another method, where we can clearly make out if it's coming from one hemisphere, we disconnect different parts of the brain where your seizure flow significantly reduces. Not that it disappears, we disconnect one area from the other and we continue on mild medication, but still your day-to-day performance improves drastically by 70%. And no visible seizures happen very frequently to you. in yet another way where both sides brain are involved. Nowadays a new technology is available. We do it as called vagal nerve stimulation. A vagus nerve is one of the nerves which controls brain with the rest of the body. When we change the electrical signal pattern of the vagal nerve, when we stimulate with the low current, putting the wire across your neck, we don't even open the brain. There is a battery available, it gives the electrical current, and whenever there is a seizure, it does, suppresses to certain extent or imitates in such a way, it suppresses it. And that also helps many of these patients. So as of now, if somebody has an intractable seizure, there is a way for you, for your quality of life, your day-to-day life, and to progress yourself in the future. And if you want to know more about it, please visit our epilepsy center at Astor Whitefield. We have a dedicated team of neurologists, neurosurgeons, neuropsychologists, neuroradiologists, just to diagnose what is happening to you, whether we can help you either by medication or by surgery or by any means. And visit us, we will take care of you with a smile.